Hello everyone, Namaste, welcome to Yoga with Dr. Joy. I am Dr. Joy and I have with me Dr. Gautami. Many women suffer from painful menstruation, also called as dysmenorrhea. During this painful menstruation, the women experience pain in the lower abdomen, the pelvis, the low back, and sometimes even on the sides of the abdomen, and the pain may even radiate to the thighs. Sometimes the pain appears suddenly during the menses, and it may be related to some kind of underlying disease like endometriosis, fibroids, and some infections like pelvic inflammatory disease. This is called as secondary dysmenorrhea, and it is always advisable that these women consult their family physician for this problem. Many a times the pain during menses is continuous. It is experienced every month by the women, and this is called as the primary dysmenorrhea. For this, the women may use some painkillers to relieve the pain. It can get addictive and it has its own side effects. So let us avoid these painkillers and learn some yoga techniques to relieve this painful menstruation, also called dysmenorrhea. We will do this yoga for dysmenorrhea in 2 episodes. In the first episode, we will show you all the techniques, the yoga techniques to be done throughout the month, just to improve the tonicity and strength of all the internal organs. Whereas in the second episode, part 2 of yoga for dysmenorrhea, we will show you the techniques to relieve the pain. And these techniques have to be done during the menstrual periods. So let us start this first episode of Yoga for Dysmenorrhea with a short prayer. So let us join both our hands and start with a short prayer. You can pray your own way just to improve focus and improve the benefits out of these practices. Let us close our eyes and chant together. Sangachadvam samvadadvam samvo manausi janatam deva bhagam yatha purve sanjanana upasate. Gently open your eyes, lower your hands. So the first yogasana is the Pada Hastasana. So let us get to the ready position, the sthiti. The hands are placed at the sides of the thighs. Gaze is straight ahead. Let's start. Inhale, raise both the hands sideways above the head, stretch upwards as much as possible. Exhale and bend forwards from the waist. Let the fingertips be placed under the toes. Try to take the forehead as close to the knees. Bend as much as possible. Feel that strain on the abdomen. This is the final position of Pada Hastasana. Practice slow, effortless breathing in this final position. Feel the strain on the abdomen. These are the asanas just to improve the tonicity and strength of the internal organs, especially the uterus. Let's get back. Inhale. Yes, let the trunk get back to the erect position. Stretch upwards. Exhale, slowly lower the hands sideways down. Relax in Shithila Tadasana. Feet are placed slightly apart. hands by the side, relax completely. This was the first asana, Pada Hastasana, that we've completed. The next asana is the Pavana Muktasana. So we need to sit in this position. Pavana Muktasana is done in the supine series. Let us lie down on the back. We'll practice Pavana Muktasana with both the legs. We are doing it in 2 steps. You can practice along with us. Let's start. Inhale. Take a deep breath in. Raise the hands above the head and both the legs at 45 degrees. Exhale. Bend the legs, interlock both the hands around the knees. Raise the chest and head. Try to touch the chin to the knees. Notice that the thighs are brought completely over the chest and the abdomen. Hold this position with slow, effortless breathing. This is Pavana Muktasana. In this position, feel that strain over the abdomen. Very, very useful in cases of dysmenorrhea. Let's get back. Inhale. Inhale and raise both the legs at 40 degrees and hands above the head. Exhale and lower the hands and feet and get them back onto the floor. Relax in Shavasana. Get both the palms slightly away from the body. Place both the legs slightly away from each other and relax completely. The next asana that we are going to practice is called the fish pose or Matsyasana. So let us sit in Padmasana first. Yes, you can sit erect. Fold the legs one above the other and get to Padmasana. Yes, place the right foot over the left thigh and place the left foot over the right thigh. Yes, now slowly and gently bend backwards. Use your elbow and hands. Bend backwards and lie on the floor. Raise the shoulders and make sure that the crown of the head is placed firmly on the floor. Yes, notice that the shoulders are in the air. The crown of the head is on the floor. Yes, you can hold both the toes with the hands, with the fingers. This is the fish pose, also called as Matsyasana. Practice slow, effortless breathing in this final position. Let's maintain for a few more seconds. This is Matsyasana. Notice the gap that is seen under the shoulders. Gently now use your hands and come back to the erect position, sitting erect position. Yes, get back to Padmasana. Now lower the legs. Yes, release the legs and you can now relax in Shitila Dandasana. Yes, place some gap between both the feet. Just slightly bend backwards. Support your back with the palms. Neck is placed on any one side. This is Shitila Dandasana. This is the relaxed position in the sitting series of asanas. After every asana, we need to relax and experience the benefits of the asana. So we've practiced three asanas: the Padahastasana, the Pavanamuktasana, and the Matsyasana. As I have just mentioned, this is the first episode of Yoga for Dysmenorrhea, and these are the techniques that have to be done right throughout the month before the menses or the menstrual cycle start. And these are the techniques which will help to improve the tonicity and the strength of all the internal organs. Let us now just relax in this position for a few seconds. We'll go for a short break. We'll see you on the other side of the break. Namaste. Welcome back. You're watching Yoga with Dr. Joy, and we are showing you the techniques of yoga for dysmenorrhea. This is the first episode of Yoga for Dysmenorrhea, wherein we are practicing certain asanas and exercises which are to be done right throughout the month before the menstrual periods start. And these will just help to improve the tonicity and strength of all the internal organs. We've practiced a few asanas before the break. We are continuing with a few more asanas. The next asana or the next exercise is the butterfly exercise, butterfly pose. So let us start. So let us extend both the legs in front of the body. Let us bend both the legs at the knee and join both the soles together, and use your hands and pull both the feet as much behind as possible. Let the heels come close to the perineum. Now let us flap both the knees just like a butterfly. Let's flap the knees and feel the stretching in the hip joints. Practice slow, effortless breathing. Continue flapping of both the legs. Try to take the knees as close as possible to the ground. Let's practice 10 more times. Continue the practice. This is the butterfly exercise. Gently stop the practice. You can now extend both the legs in front and get back to the ready position. That is the sthiti. The next asana that we are going to do is Bhadrasana. Very similar to the butterfly exercise. Let's again bend both the legs at the knee and use our hands. Pull the heels as much as possible, as closer as possible to the perineum. Let the heels touch the perineum. You can use your hands to pull the legs as behind as possible. Take the knees as low as possible. Let them touch the ground. Head, neck, back is erect. Let your gaze be forwards. This is Bhadrasana. Bhadra means auspicious, and this is one of the asanas which is very, very useful to open up the hip joints, relax the muscles of the pelvis, tone all the muscles of the hip and the pelvis. And this is an asana which is also useful for the conditions affecting the perineal region as well. Practice slow, effortless breathing in this final position. This is Bhadrasana. Let us now extend both the legs, get back to the ready position. Let us now gently place some gap between both the feet. Place both your hands behind the back. Tilt your neck to any one side and relax in this position called as Shitila Dandasana. You can close your eyes, practice slow, effortless breathing, and experience the effects of the Bhadrasana. So here we complete the asanas for dysmenorrhea. The next technique that we are going to practice is the Nadi Shodhana, and for this we need to again get to the cross-leg position, fold both the legs, sit erect, use your right hand. Yes, you can fold the index and the middle finger, extend the thumb and the remaining two fingers, the ring finger and the little finger. This is Nasika Mudra. You can now turn it and place it right ahead of your face. We'll start with Nadi Shodhana. Close the right nostril, close your eyes. Let us now start by exhaling through the left nostril. Complete exhalation through the left. Inhale again through the left nostril only. Close the left nostril. Exhale slowly through the right nostril. Inhale through the right. Deep inhalation. Close the right. Exhale slowly through the left nostril. Again inhale through the left. And complete exhalation through the right nostril. Continue this practice. This is Nadi Shodhana. Alternate nostril breathing. So let the inhalation be deep as possible, and let the exhalation be complete exhalation as slow as possible. You can practice this Nadi Shodhana for about 10 rounds. This Nadi Shodhana helps to remove the blocks which might appear in the nadis. The human body has about 1,72,000 nadis in the body, and whenever there are a few blocks in these nadis, it causes pain and discomfort. So this Nadi Shodhana helps to remove these blocks and relieve pain. Hence, this is one of the techniques which can be used to practice throughout the month before the cycle start, and remove all the blocks which will remove the pain. Gently now stop the practice. Keep your eyes closed and experience the changes that are brought about by this practice of Nadi Shodhana. The next practice that we are going to do is Kapalbhati Kriya. So let us sit straight, keep your eyes closed. Kapalbhati, as we have practiced before, is forceful exhalation, active exhalation and passive inhalation. While forcefully exhaling, let us flap the abdomen and push the abdomen inwards. Let us start. We'll practice about 20 rounds. Let's start. This is Kapalbhati Kriya. Notice the flapping of the abdomen. Forcefully exhale. There is no forceful inhalation. While exhaling, push the abdomen inwards. Gently stop the practice. Keep your eyes closed. Observe the changes. Kapalbhati, as we know, helps in massaging the abdominal organs. The abdomen moves inwards and outwards and massages the internal organs and helps to improve its functioning and strengthen these organs. Let's practice a few more rounds. Let's start Kapalbhati once again. Notice the flapping of the abdomen. You can practice about 20 rounds. Gently stop the practice. Keep your eyes closed and observe the changes brought about by Kapalbhati Kriya. Just enjoy the relaxation now. The next practice is Ashwini Mudra. Ashwini Mudra is nothing but the contraction and relaxation of the anal sphincter, the anus. So let us sit straight, head, neck, back erect. Keep your eyes closed. Place both your palms on the knees. Let's start the contraction and relaxation of the anus. Let's practice about 10 times. Contract, relax, contract, relax, contract, relax, contract, relax. Continue this for 5 more rounds. We are practicing Ashwini Mudra, which is nothing but the contraction and relaxation of the anus. Gently stop the practice. So this Ashwini Mudra is also said to improve the functioning of all the organs around the perineal region and the reproductive organs as well. You can practice 10 more rounds. Let's start the Ashwini Mudra. Contract the anus and release. Contract and release. Contract and release. Contract and release. Continue the practice. Gently stop the practice. So we've just completed the practice of Ashwini Mudra. The last practice is the practice of the Bhramari Pranayama. Let us now use our palms, close our eyes with our palms, sit straight, close the ears with the thumbs. Let us inhale and chant the humming sound of the bee for about 5 rounds. Let's start. Inhale. Gently stop the practice. Keep your eyes closed. Lower the hands. Place them on the thighs. Keep your eyes closed and observe the changes that are brought about by this Bhramari Pranayama. So these were a few techniques, some asanas, some kriyas, some exercises, some pranayama, which will help us relieve dysmenorrhea. These were the few techniques that are supposed to be done for a month before the cycle starts to improve the tonicity of all our organs and improve the strength of our internal organs. I hope you have enjoyed this first episode of Yoga for Dysmenorrhea. In the next episode, we will show you yoga techniques which are supposed to be done during the menstrual periods to relieve the pain. I hope you will continue watching our program and enjoy all the techniques. Thank you for watching. We will end this episode, the first episode of Yoga for Dysmenorrhea, with a short prayer. Let us join both our hands, close our eyes and chant the Shanti mantra. Sarve bhavantu sukhinah, sarve santu niramayaः, sarve bhadrani pashyantu, ma kaschid dukkha bhag bhavet. Om Shanti Shanti Shanti. Namaste.